Okay, so you're gearing up for a palliative care social worker interview.
Uh-huh.
That's awesome. We're going to take a deep dive today
Yeah.
into how to impress those interviewers in this really specific field
Right.
and how to totally nail those tough questions they're going to throw at you.
Absolutely.
Think of this deep dive as your secret weapon
Yeah,
to give you a real advantage going into that interview.
for sure.
We've got some awesome resources from RoleCatcher to help us out today.
Oh, yeah.
They've got a super helpful career guide, a killer interview guide,
Uh-huh.
and even some insights into how RoleCatcher's AI can help you stand out
Really cool stuff.
from all the other candidates.
Yeah,
You ready to jump in?
let's do it.
All right, so to really nail this interview, it's super important to
Yeah.
get inside the interviewer's head for a minute.
Absolutely.
What are they really looking for?
Yeah, they're looking for someone who not only has the right skills,
Okay.
but also truly has the heart for this kind of work.
So it's not just about checking boxes on a resume.
No, not at all.
They want to see the real person behind those qualifications.
Exactly. They're looking for genuine empathy and compassion,
Mhm.
someone who can connect with patients and families
Right.
during what are incredibly difficult and vulnerable times.
For sure.
Strong communication skills are also super important
Makes sense.
because you're going to be navigating a lot of
Oh, yeah.
difficult conversations, explaining complex medical information,
Right.
but you got to do it sensitively.
Wow. It sounds like this role really calls for
It does.
both a sharp mind and a big heart.
Yeah, you could say that.
Well, let's get into those sample interview questions from RoleCatcher.
Okay, let's do it.
I know our listeners are dying to hear how to tackle these.
I bet.
The first one is a classic. It's almost guaranteed to come up.
Right.
Can you tell us about your experience working with patients who are experiencing end-of-life care?
Okay, so this question is all about seeing how comfortable you are
Okay.
with the reality of palliative care. The interviewer really wants to know if you've dealt with
Yeah.
the emotional weight of this work
Yeah.
and how you handle those really sensitive situations.
I imagine they'll also be paying attention to how you talk about your experiences.
Oh, absolutely.
Are you distant and clinical?
Right.
Or do you come across as really empathetic and compassionate?
You got it.
That's what they want to see.
When answering this question, remember, you don't necessarily need
Okay.
direct experience with end-of-life care specifically.
So it could be other kinds of experiences,
Exactly.
like volunteering in a hospice setting,
Yeah.
working with patients who have serious illnesses,
Mhm.
or even personal experiences you've had with your own family members.
That's right.
The key is to highlight transferable skills.
Yes.
Okay, so let's say I volunteered at a nursing home
Okay.
and I help residents with their emotional needs.
Yep.
Would that be relevant here?
Absolutely. Focus on those active listening skills.
Okay.
Any empathy you showed, and any specific ways you learned to provide comfort and support.
So it's about taking those experiences
Right.
and showing how they connect to the skills needed in palliative care.
Exactly. RoleCatcher actually offers a really solid sample response
Oh, cool.
for this specific question.
Let's hear it.
Okay, it says,
Mm-hmm.
in my previous role at previous employer, I had the opportunity to work with several patients receiving end-of-life care.
Okay.
One particular experience that deeply impacted me involved a patient with terminal cancer.
Mm-hmm.
I provided emotional support to both the patient and their family, helped them understand their options,
Okay.
and coordinated with the medical team to ensure their comfort.
Yeah.
This experience solidified my passion for palliative care and taught me the importance of empathy, active listening, and clear communication.
Wow, that's a great example. It really shows how the candidate was involved
Right.
and the skills they developed.
It really does. It showcases both the experience and those key qualities that interviewers are looking for.
Okay, so we tackled that first question.
We did.
Let's move on to the second one, which focuses on communication skills.
Right, bring it on.
How do you approach difficult conversations with patients and their families?
Oh, this is a tough one.
I know, right? I'm already feeling the pressure just thinking about it.
It is challenging.
So how can our listener prepare for this kind of question?
Well, remember, the interviewer is trying to assess how you handle those really emotionally charged situations,
Yeah.
how you deliver difficult news
Right.
with compassion, and how you help people process complex information.
I'm guessing a common follow-up question might be,
Oddly?
can you give me a specific example of a time
Oh, yeah.
when you had to have a particularly difficult conversation with a patient or their family?
For sure.
And then, of course, how did you handle it?
That's coming.
Yeah, so it's
Right.
best to have a story ready.
Definitely.
A real example
Absolutely.
from your own experience.
When you share that example, focus on the steps you took to create a safe space for that conversation.
Okay.
How you really listened to their concerns
Right.
and their fears, and how you communicated clearly and sensitively.
So it's not just what you say, but
Right.
how you say it.
Exactly.
Your tone of voice,
Right.
body language, that whole atmosphere you're creating
That's right.
makes a huge difference.
And don't be afraid to show a little vulnerability.
Oh, interesting.
It's okay to acknowledge that these conversations are tough
Okay.
and that they impact you emotionally,
Right.
as long as you're still professional, of course.
That makes sense.
Authenticity and empathy go a long way.
I like that.
All right, let's see what RoleCatcher suggests for this question.
Okay, what's their sample response?
They say,
Mm-hmm.
I believe in open and honest communication while being empathetic and sensitive.
Okay.
I start by actively listening to the patient and their family, acknowledging their emotions and concerns.
Okay.
I then explain the situation clearly and answer their questions honestly.
All right.
For example, I once had to explain the limitations of life-sustaining treatment to a family who was struggling to accept their loved one's prognosis.
Wow, that's a tough one.
It is.
Yeah.
I provided emotional support, answered their questions patiently, and ultimately helped them make informed decisions aligned with the patient's wishes.
That's powerful.
It is.
It shows the candidate's approach and their ability to handle a really challenging situation
Yeah.
with a lot of grace.
That specificity really makes it come alive.
Okay, let's move on to question number 3.
Okay.
This one is all about advocacy. Can you describe a time when you had to advocate for a patient's needs?
This is a big one.
It is.
Advocacy is so important in social work,
Absolutely.
especially in healthcare.
So what are they looking for here?
They want to see if you're a champion for your patients, if you're willing to go the extra mile to make sure their needs are met.
So someone who's proactive, resourceful,
Yeah.
maybe even a little fearless.
Exactly. They want to know that you won't shy away from challenges
Right.
and that you're committed to fighting for your patient's well-being.
Okay, so when you're answering this question,
Mm-hmm.
you want to pick a situation where you saw an unmet need
Yeah.
and then outline the steps you took to address it
Exactly.
and really highlight that positive outcome
That's right.
that you were able to achieve,
For the patient.
right, for the patient.
The interviewer might also ask, what specific steps did you take to make sure the patient's voice was heard?
Okay.
And what was the outcome of your advocacy?
Another great follow-up question.
Yes.
Really gets to the details.
Mm-hmm.
So be prepared to answer that.
Absolutely.
brilliant.
They want to see you in action.
I love it.
I bet RoleCatcher has a good example of this, too.
I'm sure they do.
Yeah.
What does their sample response say?
Okay. It says, while working at a previous employer, I encountered a patient who was having difficulty accessing necessary home healthcare services.
Okay.
This was due to insurance limitations.
I can see that happening.
Oh,
Happens all the time.
It does.
Yeah.
I contacted the insurance company, advocated for the patient's needs,
Mm-hmm.
and provided documentation to support their case.
Okay.
As a result, the patient was granted the required home health care services,
Great.
enabling them to receive care in the comfort of their own home.
That's a fantastic example of advocacy in action.
It is.
It shows persistence, knowledge of the system,
Yeah.
and that real dedication to the patient.
Mm-hmm.
All right, question number 4 focuses on cultural sensitivity.
Mm-hmm.
Can you discuss your experience working with diverse patient populations?
This one's so important.
It is. Especially these days,
Right.
we're so much more aware of how important it is to be inclusive
Yeah.
and culturally competent when providing care. So what are the interviewers trying to figure out with this question?
They want to know if you understand the nuances
Okay.
of providing culturally sensitive care.
Okay.
And if you can adapt your approach to meet the unique needs of patients
Yeah.
from all sorts of backgrounds,
Makes sense.
they might ask, how do you build rapport and trust with patients from different cultural backgrounds?
That's a good one.
Yeah, so be ready to share examples of your experiences
Okay.
working with diverse populations and highlight your ability to communicate effectively, even when there are cultural differences.
Right.
Talk about how you actively try to understand and respect individual values.
So it's not just about being tolerant.
No,
It's about really embracing diversity and making it part of how you approach care.
exactly. It's about being sensitive to those cultural differences, being aware of your own biases,
Yeah.
and being willing to learn and adapt.
That's so important.
What does RoleCatcher have to say about this?
Okay, let's hear their sample response.
Here it is.
Okay.
Throughout my career, I have had the privilege of working with patients from various cultural and socioeconomic backgrounds.
Okay.
I believe in treating each patient as an individual and understanding their unique needs and perspectives.
Okay.
For example, I once worked with a patient who was hesitant to disclose certain medical information.
Oh, wow. I can see that happening.
It does.
Sometimes.
This was due to cultural beliefs.
Right.
I took the time to build rapport, learn about their culture, and explain the importance of open communication in a way that respected their beliefs.
That's awesome.
Yeah.
It's a delicate balance.
It is.
Yeah.
As a result, I gained their trust and was able to provide effective care.
That's a great example of how cultural sensitivity can really make a difference for the quality of care.
For sure.
Okay, let's move on to question 5, which is all about teamwork.
All right, bring it on.
How do you work collaboratively with other members of the interdisciplinary team?
Ooh, teamwork.
That's essential.
Yeah.
It really is.
In palliative care.
So the interviewers want to know that you can work well with everyone.
Okay.
The doctors, nurses, chaplains, all the other professionals involved.
Right.
They're looking for someone who can communicate clearly, listen actively, respect different perspectives, and ultimately work together towards that common goal.
That's teamwork.
It is.
And I'm sure they're also interested in how you handle conflict.
Oh, for sure.
Because let's face it, there's going to be conflict.
It happens.
Especially when you're working on such a complex team.
Right.
So they might ask something like, can you share an example of a time when you had to resolve a conflict or disagreement within the team, and what was your approach?
Yeah, that's a classic.
So it's not just about avoiding conflict altogether, but about managing it effectively.
Exactly.
What's RoleCatcher's take on this?
Their sample response is,
I believe in clear and open communication with all members of the interdisciplinary team.
okay.
I actively listen to their perspectives, share information, and work collaboratively to develop the best care plan for the patient.
That's the goal.
It is. For instance, I once worked with a nurse who had concerns about a patient's medication regimen.
Correct.
I listened to their concerns, reviewed the patient's chart, and then discussed the issue with the physician.
Okay.
We worked together to adjust the medication regimen, which ultimately led to a better outcome for the patient.
That's teamwork.
It is.
That's collaboration. All right. I'm ready for question 6. What's next?
Okay, this one gets into the ethical considerations
Ooh.
of palliative care.
Okay.
How do you approach ethical dilemmas in your work?
That's a heavy one.
It is.
I can imagine there's some really tough ethical challenges
Oh, absolutely.
that come up in this field.
Palliative care often involves some really complex ethical considerations.
And the interviewers want to see that you can handle those challenges
Okay.
with sensitivity, thoughtfulness, and a strong ethical compass.
I bet they'll ask for a specific example.
For sure.
Something like, can you describe a specific ethical dilemma you've encountered in your work?
Yep.
And how you navigated it, considering the ethical principles involved.
That's a good one.
Yeah. They want to see how you think,
They do.
how you approach these tough situations.
Be honest and authentic.
Okay.
You don't need some dramatic life or death scenario.
Okay.
A smaller scale ethical challenge is fine. The point is to show your thought process
Right.
and your commitment to ethical practice.
So you're demonstrating that you can wrestle with those difficult questions
Right.
in a responsible and informed way.
Exactly.
Yeah.
They want to see that you're aware of those ethical principles,
Okay.
that you consider different viewpoints,
Yeah.
and that you're committed to making decisions that are in line with your values.
And professional guidelines.
Okay, what does RoleCatcher say?
Their sample responses. I once encountered a situation where a patient's family requested a treatment option
Okay.
that I felt was not in the patient's best interest.
Oh, wow.
Yeah.
That's a tough one.
I approached this dilemma by first consulting with the patient,
Okay.
respecting their autonomy and understanding their wishes. I then discussed the family's request with the medical team
Okay.
and explored alternative options that would prioritize the patient's well-being
Okay.
while considering their values and beliefs.
That's tricky.
Is
Trying to balance all those different perspectives.
Exactly.
Ultimately, we developed a care plan
Okay.
that aligned with both the patient's wishes and ethical guidelines.
That's a really insightful response.
It is.
It shows that commitment to patient-centered care, understanding those ethical principles, and being able to handle those complex situations sensitively and professionally.
Yeah. Okay, question number 7 brings us back to supporting families.
Okay.
How do you provide support to family members of patients receiving palliative care?
Families are going through so much during this time.
They are.
It's an emotional roller coaster.
Yeah,
And they need just as much support as the patient does.
they really do.
The interviewers want to see that you understand that,
Mm-hmm.
that you get those multifaceted needs of families,
Mm-hmm.
and that you're ready to provide emotional support, practical guidance,
Right.
and help them access resources.
They're looking for the whole package.
They are.
They might ask, what resources or strategies do you use to help families cope with the emotional and practical challenges of caring for a loved one with a serious illness?
That's a good one.
It is.
So be ready to talk about specific tools and strategies that you use,
Okay.
like active listening, showing empathy,
Mm-hmm.
providing emotional support.
Right.
Be specific about how you've helped families in the past. Maybe you help them understand their loved one's condition better.
Okay.
Maybe you help them cope with their own emotions, or navigate those really complex medical decisions,
Yeah.
or connect them with community resources.
So many aspects to it.
There are.
It's about providing that holistic support
It is.
that addresses both the emotional and the practical.
boy.
Okay, what's RoleCatcher's take on this one?
They say. I believe in providing emotional support and practical assistance to family members.
Okay.
I encourage them to share their feelings, offer guidance on caregiving tasks,
Mm-hmm.
and connect them with support groups and community resources.
Okay.
For example, I once connected a family with a local hospice organization that provided respite care,
Okay.
allowing them to take a much-needed break from their caregiving responsibilities.
That's a great example of how a palliative care social worker
It is.
can be an advocate
Mm-hmm.
for both the patient and the family.
That's right.
All right, we're getting close to the end.
We are.
What's question number 8?
Okay, this one comes back to cultural sensitivity again.
Okay.
How do you ensure that patients' cultural beliefs and practices are respected
Mm-hmm.
and incorporated into their care?
That's another super important piece
It is.
of palliative care.
Especially as our society becomes more and more diverse.
Exactly.
It sounds like they want more than just a surface-level understanding here.
I do.
They want to see how you put your knowledge into action.
Okay.
So be ready to talk about specific situations where you adapted your approach to care to fit with a patient's cultural beliefs.
Okay.
Maybe you sought out resources to learn more about those cultural nuances,
Yeah.
or advocated for culturally appropriate care within the system.
So many ways to demonstrate this.
There are.
What kind of follow-up question might they ask?
They might ask,
Hmm.
can you share an example of a time when you had to adapt your approach to care to accommodate a patient's cultural beliefs?
I like it. Gets right to the heart of it.
It does.
When you answer this, emphasize your willingness to learn,
Yeah.
your commitment to respecting different perspectives, and your ability to bridge those cultural gaps
That's key.
in a way that really benefits the patient.
It's about going beyond the textbook and
Yeah.
showing real cultural humility.
What's RoleCatcher's sample response?
Okay, they say. I always strive to learn about my patients' cultural beliefs and practices
Okay.
and incorporate them into their care plan. I ask open-ended questions, listen attentively, and consult with cultural liaisons or other resources when needed. For instance, I once worked with a patient whose family requested a traditional healing ceremony.
Okay.
I worked with a medical team to ensure that the ceremony could take place safely and respectfully within the hospital setting.
That's amazing.
It is.
Advocating for that cultural sensitivity within what could be a really challenging environment. The candidate showed respect for the patient's beliefs and was willing to work with the healthcare team.
That's what it's all about.
Okay. Are you ready for a question that really tests those problem-solving skills?
I think so. Bring it on.
All right. Question number 9.
All right.
Can you tell us about a time when you had to navigate a complex healthcare system
Oh, boy.
to ensure that a patient's needs were met?
This is a real-world challenge.
It is. Healthcare systems can be so complex,
Yeah.
frustrating, even for those of us who aren't working within them.
Right.
So what are they looking for with this question?
They want to see if you can advocate for your patients,
Okay.
even when you're up against those bureaucratic hurdles,
Right.
dealing with red tape
Yeah.
and pushing for solutions. They want someone who's resourceful, persistent,
Okay.
doesn't give up easily.
I bet they're also listening to how you talk about this experience.
Oh, yeah.
Did you get frustrated and quit?
Right.
Or did you approach the whole thing with a problem-solving mindset?
They want to see that resilience,
Makes sense.
that commitment to finding solutions.
Yeah.
Even when it's tough.
Right.
They might follow up with,
Okay.
what were the specific challenges you faced?
Mm.
And how did you overcome them to get a positive outcome for the patient?
Another great follow-up question.
It is.
It makes you give real concrete examples of your problem-solving skills.
So walk them through the steps you took,
Okay.
the challenges you encountered, and how you advocated for your patient.
What's RoleCatcher's sample response?
Here's what they suggest. I once worked with a patient who needed specialized equipment
Okay.
after being discharged from the hospital. Navigating the insurance approval process was challenging and time-consuming.
I can imagine.
Yeah. It involved multiple phone calls and appeals.
Oh, yeah.
Yeah.
Classic.
I persisted in my efforts, gathered all the necessary documentation, and worked closely with the patient's family to ensure they received the equipment in a timely manner.
There you go.
Yeah.
Persistence pays off.
It does.
All right, we've covered 9 questions so far.
We have.
I'm feeling pretty good about this.
Good.
What's the final question?
Okay, this last one brings us back to the core of palliative care.
Okay.
How do you provide emotional support to patients who are nearing the end of their lives?
This question really gets to the heart of it all.
It does,
doesn't it? Providing comfort and compassion,
Yeah.
that human connection during such a profound and often difficult time.
Absolutely.
So what are they looking for here?
They want to see if you have the emotional depth and sensitivity to handle these conversations with grace and empathy.
Okay.
They're looking for someone who can create a safe space for patients to share their feelings and fears.
Yeah.
Someone who can offer comfort
Right.
and just be present with them.
That's so important
It is.
during this difficult journey.
The interviewers might ask, what specific techniques or approaches do you use to create a safe and supportive space for patients to express their feelings and fears?
Oh, that's a good one.
Yeah,
So have those examples ready.
absolutely.
Specific techniques, approaches you use.
Like active listening, validation, mindfulness exercises,
Okay.
or just creating a really calm and comforting environment. There's no one right answer here.
Right. It's about being adaptable,
It is.
meeting the needs of that individual patient,
Exactly.
being present with them and their experience.
That's what matters.
What's RoleCatcher's sample response?
Oh, okay, they say. I believe in providing a listening ear, offering words of comfort, and simply being present with patients. I create a safe and non-judgmental space for them to express their emotions and fears.
Right.
I also use techniques like guided imagery and relaxation exercises to help them manage anxiety and promote a sense of peace.
That's really beautiful.
It is.
It's not about fixing things
No.
or solving problems,
It's about being there.
but being present,
Yeah.
offering support, however that patient needs it.
It's about recognizing their humanity and honoring their experience,
Yeah.
even in the face of death.
Wow, we've covered 10 challenging interview questions,
We have.
and I feel like I've learned so much.
Good. All right, so we just went through some of those tough interview questions.
We did.
Now let's zoom out a bit.
Okay.
Look at the bigger picture of what a career as a palliative care social worker actually looks like.
I like it.
RoleCatcher's Career Guide has some great insights here
Awesome.
about the work environment,
Okay.
the pros and cons you might encounter, and the overall career outlook.
You know, when I think of palliative care,
Yeah.
I immediately picture hospitals,
Right.
but I'm guessing the skills are needed in other settings too.
Oh, absolutely. Hospitals are common, but definitely not the only place. Palliative care is provided wherever people with serious illnesses are.
That makes sense.
So that could be hospice facilities, long-term care facilities, home health care agencies, even private practice.
Wow. So the day-to-day experience
Yeah.
could be pretty different depending on the setting.
Exactly.
Like working in a hospital probably involves a lot of collaboration with medical teams
For sure.
and navigating all those discharge planning processes.
Oh, yeah, all that paperwork.
Right.
Whereas home health care might involve more travel
That's true.
and a bigger focus on supporting families in their own homes.
That's a good point.
What about the pros and cons of this career path?
Yeah, the RoleCatcher Guide mentions that this work can be both incredibly rewarding and emotionally challenging.
It's definitely both.
So let's start with the positives. What makes this such a rewarding career?
Well, for one, you're making a real difference in people's lives.
Yeah.
During a time when they're incredibly vulnerable.
Yeah.
You're providing emotional support, advocating for their needs, helping them make difficult decisions, and connecting them with important resources.
So you're really walking alongside them.
You are.
Or a really tough time.
You're also part of a team.
Yeah.
Working with doctors, nurses, chaplains.
Right, that whole interdisciplinary team.
Exactly, all dedicated to providing that holistic care.
It sounds amazing.
It is.
But like you said, there's also a flip side.
There is.
What are some of the challenges that come with this kind of work?
The emotional toll is real.
Yeah.
You're dealing with loss and grief constantly. You're witnessing people suffering.
Right.
You're supporting families through some of the most difficult experiences imaginable.
That's heavy stuff.
The guy talks about burnout.
Yeah.
And compassion fatigue. Those are real concerns in this field.
They are. It takes a strong person
It does.
to handle that emotional weight.
Yeah.
And still maintain that empathy and compassion.
You got to have really good self-care practices.
Yeah.
And a strong support system.
Absolutely. Can't pour from an empty cup.
Exactly.
Okay, let's talk about the career outlook for a minute.
Okay.
What does the future hold for palliative care social workers?
The good news is the demand is projected to grow a lot in the next few years.
Oh, that's awesome.
The guide actually mentions a 14% increase over the next decade.
Wow, that's much faster than average.
It is.
Job security is always nice.
Especially in a field that's so meaningful.
So true.
I'm guessing this growth is partly due to the aging population.
Probably, and maybe just more awareness of what palliative care is all about.
You nailed it.
As people live longer and with more chronic illnesses,
Yeah.
the need for these services is only going to increase.
It is.
Okay, let's talk about certifications for a second.
All right.
I know a lot of healthcare professions have specific credentials
They do.
that can give you a leg up in the job market.
The guide mentions one in particular.
Oh, which one?
The Certified Hospice and Palliative Social Worker certification,
Okay.
or CHPSW.
Mm-hmm.
It shows you're committed to the field
Okay.
and that you have specialized expertise in this area.
So even though it might not be required,
Right.
having that certification could make you stand out from other
Certainly.
applicants.
It shows potential employers that you've gone above and beyond to develop your skills and knowledge.
I like it.
All right, so we've talked about the career path,
We have.
the work environment, and the overall outlook for palliative care social workers.
Yeah. And now I'm really excited to get into the AI side of interview prep.
Okay.
You mentioned RoleCatcher can actually help tailor your answers and give you feedback for specific jobs.
This is where it gets really cool.
Okay, I'm intrigued.
RoleCatcher's AI can analyze a job description.
Wait, it can actually read a job description.
It can.
Wow.
And figure out what the employer is looking for.
No way.
Yep, it's like a secret decoder ring for job descriptions.
That's amazing.
Then it uses that information to suggest ways you can tailor your answers.
So it takes all the guesswork out of it.
It does.
That's so helpful.
It helps you present your skills
Okay.
and your experience in a way that lines up perfectly with the job requirements.
It's like having a personalized interview coach.
Right in your pocket.
In your pocket. I love that.
This is a game changer for anyone who struggles with interview prep.
It is. It's so much easier to prepare
Right.
when you know exactly what the employer wants.
And beyond that, RoleCatcher's AI can actually help you find
Find a way.
skills gaps in your application.
Skills gaps. What do you mean by that?
Well, it might find certain skills or experiences
Okay.
that employers in this field really value, but that you haven't highlighted in your resume or cover letter.
So it's like having an expert reviewing your application
Exactly.
and saying, hey, you should emphasize this more.
And the best part is it doesn't just point out the gaps.
Okay.
It offers suggestions for how to fill them. Maybe add keywords to your resume.
Okay.
Maybe highlight relevant experiences in your cover letter.
Right.
Or even suggest getting additional training or certifications.
It's like having a personalized career advisor.
Right. Guiding you every step of the way.
This AI feedback is probably super helpful
It is.
for really competitive jobs
Especially then.
when you need to stand out from the crowd.
Yeah.
This reminds me of a friend of mine who was applying for a nursing position, a really competitive one.
Tough field.
It is.
Yeah.
She used RoleCatcher's AI to prep for her interview,
Oh, cool.
and she said it was amazing.
Good.
It helped her tailor her answers, highlight her best experiences, and guess what? She got the job.
That's fantastic.
It's her dream job.
That's awesome.
I'm so happy for her.
It just goes to show how AI can be a powerful tool
It can.
when you're job searching.
Okay, so we've covered a lot of ground today.
We have.
Those essential interview questions, insights into the career itself, and all the amazing ways AI can help you prepare.
I'm feeling pretty informed.
Me too.
But before we wrap things up completely, there's one more piece we need to talk about.
Okay, I'm all ears.
Your personal motivations.
Okay.
And how to express those authentically in the interview.
Ooh, I like that. Let's dive into that. We've covered so much in this deep dive.
We have.
From those tricky interview questions to what it's really like to be a palliative care social worker.
Right. The whole picture.
And we even talked about all the amazing ways AI can help you prepare.
Super helpful tools.
So as we wrap things up, what are your final thoughts for our listener?
Okay, so I think what's really interesting here is how much this role emphasizes the human element.
Right. It's not just about the technical stuff.
It's not.
It's about connecting with people.
Yeah, exactly.
On a really deep level.
You need a good understanding of healthcare systems and procedures.
Of course.
But at the end of the day, it's your empathy, your communication skills, and your genuine passion for this work.
That's what will really stand out to the interviewer.
It will.
It's a good reminder that while those technical skills are important, the real heart of palliative care is about human connection.
It is.
It's about meeting people where they are.
Absolutely right.
Offering support when they're at their most vulnerable.
You're not just dealing with medical charts and diagnoses. You're supporting real people, real families.
Yeah.
Going through some of the most difficult experiences imaginable.
It takes a special kind of person to do that.
It does.
And speaking of the challenges of this work, we did talk earlier about burnout and compassion fatigue.
We did.
It's important to go into this interview with a realistic understanding of both the good and the bad.
You got to be prepared for the emotional toll.
Right.
And have good self-care strategies in place.
Interviewers will probably ask about that too.
Oh, for sure.
They want to know that you're taking care of yourself.
It's essential.
So you can take care of others.
Absolutely.
So all those resources we've talked about today, the career guide, the interview guide, RoleCatcher's AI tools.
It's all there to help you.
To empower you to go into that interview feeling confident.
Like you have a whole support system behind you.
I like that.
But remember, it's not just about acing the interview.
Okay, what else is it about?
It's about finding the right fit. This is a tough but incredibly meaningful career.
It is.
And you need to be clear about why you want to do this.
What are your motivations?
Exactly.
That's something for our listener to really think about as they prepare for this interview.
Ask yourself, what is it about palliative care social work that really speaks to me? And how can I share that passion with the interviewer?
That's a great question to reflect on.
Dig deep. Figure out what drives you, what inspires you.
What makes you want to get up every morning.
Yeah, and do this work.
Once you have that clarity,
it'll show.
It'll shine through in your answers, your energy.
Like your whole presence.
That's when you know you're on the right track.
You got it.
When your passion is your guide, you'll connect with the right employer.
And when you're passionate about what you do, it really shows.
It does.
That passion is contagious. It inspires others.
Right.
It creates connections, and it makes a real difference in the lives of the people you serve.
Well said.
And don't forget, RoleCatcher has all those resources to help you on this journey.
We do. Free account sign up. To unlock all those AI features.
It's so helpful.
That can help you fine-tune your application and really nail those interview questions.
Absolutely.
Well, from both of us.
Yeah.
We wish you the best of luck in your interview.
You're going to do great.